Jay Pendleton, MedTech Voice here at ESMIS, just wrapped day one. Dr. Phil Louie, can you explain, and we'll introduce everyone as we explain, kind of some things. Can you just share why you come to ESMIS? A lot of meetings, you got a busy practice family, right? This is a time commitment, so maybe share the value.
Thanks for having us on too. I mean, I think that's the question we always get, right? Why are we taking time away from our families? And all of our kids started school this week. And so there really is a commitment and some sacrifice. But I think if we take a step back, there are so many ways that we can impact patients' lives outside of the operating room, outside of our clinic space. And part of that is taking a step back from sort of the daily grind of the work that we do and collaborating with others, right? So that we're not working in a silo, we're not sort of going through the struggles alone, but we're not also sort of celebrating what's going well by ourselves. And so taking some time away, and I'm with my colleagues and my partners here today, allows us an opportunity to see a lot of our friends and colleagues, and we're sharing our experiences, right? We're going through a lot of the similar struggles, and that's not what it always feels like back at home. But we're also just learning, right? How can we continue to get better at what we're doing, and how are other people doing things? And this is a great venue for that.
What can you share about Virginia Mason or ESMIS, whatever you'd like to share?
We are, I guess, 3 of the 4 members of the Seattle spine team, and so we have, I think, a fairly unique group up in Seattle. We're a combination group of both orthopedic surgeons and neurosurgeons who have, I think, a fairly comprehensive spine program. We take care of complex adult pathology, including spinal deformity, thoracic disc herniations, tumors, infections. We also have a really burgeoning minimally invasive spine practice led by Phil Louie. And I think that we see a lot of patients from far reaches of the United States, heavily concentrated in the Pacific Northwest, but people from all over the country see us with some of the preferred contracts that we have. And so I think that our combination of both orthopedics and neurosurgery, as well as our academic focus, both in research and in training fellows in the next generation of spine surgeons, makes this a fairly unique program.
This is actually my first time at ESMIS, I will admit, and I'm pleasantly impressed and surprised. I have done a fair amount of minimally invasive surgery throughout my career, but it was always then under the auspices of AANS or CNS, where it was just mixed in with all the rest of the spine. And I think that this is really an intriguing way to focus on minimally invasive spine, to see what other people are doing. It's allowed me to challenge the way that I've been doing things and think about the questions for the next year. As Venu mentioned, we also do have a spine fellowship, and we have recently expanded that from primarily a deformity-based fellowship to also then including many more minimally invasive techniques. And I think in the discussions that we've had with current residents or theoretical upcoming fellows, it's been really exciting.
What can you share about your vision of the practice now versus kind of like maybe where it's going?
Yeah, that's a great question. That is sort of one really unique aspect of Virginia Mason, and Michael Porter, way ahead of his time, in talking about value-based care and this whole concept of lean methodology and sort of the standardization of processes, because the thought is you can't improve unless there are standards set. I think one area of medicine that gets both used in a cliche a lot and often overlooked is sort of the aspect of team medicine, right? Where 1 + 1 really equals 3 or 4, and that's the whole concept of sort of the team, which Dr. Namani mentioned earlier when he was giving a talk on artificial intelligence and how that would predict everything, but you can't take out the human element of what we do, and that's not just a single person making a decision, but bringing people together and then sort of attacking a problem or dealing with patients that way, and that's sort of what Michael Porter was talking about as well.
How do you manage access? Like, y'all are worth waiting for, in my estimation, but if a patient is in pain, they may go to the person that has no wait.
I think there are clearly some models that people have developed with sort of a private practice framework, right? That where they are able to be ultra responsive because that's their business. We are part of a larger corporation, and so we are beholden to their inefficiencies at times, despite whatever we may want to do, or how willing we are to be available the next day for someone. People sometimes do have to navigate a difficult system. I think the trade-off is that we are motivated by good outcomes for patients. We are motivated, we would say, to really try to do the right thing, whether that's surgical or non-surgical. And so some sometimes we may be worth waiting for.
It's been great. So keep it up. But
Thank you so
and
much.
thank you for spending time. I don't want to keep you. I know there's fun to be had, and I'll be right there behind you. But really appreciate all that you do, Virginia Mason, for Spine at Large. So thank you.